All right, here we are with our monthly planner guidelines, so how to fill this one out. And now this process needs to be driven by you because you obviously know your routine best, but it's also important to understand how much exercise we should be doing. Now, the ultimate aim is to be getting or accumulating 150 minutes, so 2.5 hours of moderate intensity exercise. So that's considered planned exercise rather than incidental. And it's exercise that generally takes your breath away. So if it is cardio driven, then it's enough to get your heart rate elevated, maybe even get a light sweat on. But also we use quite often in the fitness industry a thing called a talk test. So if you've got someone right next to you going through the same exercise regime and you're struggling to hold a constant conversation because you need to catch your breath, that intensity is what we're looking for. All right, if you're chatting away and everything's great and you're completing these exercises, maybe look to increase the intensity a little bit. But at the other end, if you're working too hard and you're really struggling to get sentences out and you can only talk in a couple of words at a time before having to catch your breath, you've probably pushed it too far. So I'll use yourself as a guideline, and generally a safe rule, particularly if you're around treatment, is to err on the side of caution. All right, so don't push yourself too hard. Make sure that there is mild discomfort because that's where the body tends to grow, but no pain. All right, and particularly if you're after any major surgeries, you should be clearing these type of movements either with your physio that hopefully would have been provided through in the hospital, or hit me up with some guidelines if we need to manipulate things and make sure that you are doing the right type of exercise. Within that 150 minutes of the week, we need to dedicate 2 days to do weights-based training. So that can be body weight related. And the purpose of this program was to provide exercise that didn't require equipment. All right, so a lot of the exercises that I've put in there are utilizing your own body weight or common household items like a towel, like a tennis ball. So you should be able to complete most of the exercises and most of the programs without relying on equipment. All right, if you do have access to equipment and you're looking for a specific workout, please hit me up. So with your monthly planner, it is best at a maximum to plan out 2 weeks at a time. All right, just because we know that things do pop up from time to time and you ends up losing that motivation. And then that 3rd week and the 4th week of the month, you can actually tweak the specifics a little bit better and realize that that was a little bit out of my reach to complete that particular workout. And then the more you do this process is you'll start to build routine, and that's what it's all about, sustainability of exercise. All right, it's not about kicking goals for 2 or 3 weeks and then letting it drop off. It's basically building in strong, safe exercise regime that is sustainable long term. All right, and utilizing these skills and building your knowledge so that when big roadblocks get in the way, like surgery, that you can rebuild and start again utilizing the same skills. With your monthly planner, you need to obviously put in duration of your exercise sessions. So you'll notice on all the exercise programs, I've got a rough duration depending on how much rest you need. That'll give you a good guideline as to how long that particular session will take. For your walks and maybe your regular exercise programs, for those of you who have a gym membership and maybe complete yoga or Pilates or any of those structured group programs, slot them in because they all count. If you're playing social sport, you're lucky enough to be doing that, then by all means pop that in. And if you've got any large social commitments, you need to sort of allocate those because that can be the barrier to your exercise on that particular day. For me, particularly around chemo, I would always dedicate my training earlier before going in and plugging in at 9 o'clock. I'd be getting up early and doing some circuit-based work just to sort of elevate my heart rate and get my body and my brain ready for chemotherapy. My rest day of the week was the day after, so still plugged in. I allocated that day to rest day, and that was a chance for my body just to recover. So you're going to find the best routine for yourself. If you struggle with this process, please reach out. Again, this is what I do for a living, and I enjoy doing it. So please reach out if you have any issues building your monthly planner.